Most people feel embarrassed to talk about this problem, even with their doctor, but the truth is, millions of people suffer from hemorrhoids at some point in their life, and many of them keep struggling for years because they don't really understand what is actually causing the problem. They try creams, they try home remedies, they try painkillers, and sometimes the symptoms go away for a few days, but then the pain, itching, swelling, or bleeding comes back again. If you have ever felt burning pain after going to the toilet, if you have ever noticed blood on the tissue, if you feel a lump near the anus, or if sitting for a long time feels uncomfortable, then this video is for you. Today, we are going to talk about hemorrhoids, also known as piles, what they really are, why they happen, why they keep coming back, and most importantly, how you can get rid of hemorrhoids naturally and safely by fixing the real cause instead of only treating the symptoms. First, let's understand what hemorrhoids actually are, because many people think hemorrhoids are some kind of disease or infection, but that is not true. Hemorrhoids are swollen veins in the lower part of the rectum and anus. These veins are already there in every person. They are a normal part of the body, but when too much pressure builds inside them, they become enlarged, inflamed, and painful. You can think of them like varicose veins, but instead of being in the legs, they are inside or around the anus. Some hemorrhoids stay inside the rectum, and these are called internal hemorrhoids, while others form under the skin around the anus, and these are called external hemorrhoids. Internal hemorrhoids usually cause bleeding without much pain, while external hemorrhoids can cause strong pain, itching, swelling, and sometimes a hard lump. Now the important question is, why do hemorrhoids happen in the first place? Most people believe hemorrhoids only happen because of constipation, and yes, constipation is one of the biggest causes, but it is not the only cause. Hemorrhoids happen when there is repeated pressure on the veins in the rectum. This pressure can come from straining during bowel movement, sitting too long on the toilet, chronic constipation, chronic diarrhea, pregnancy, lifting heavy weight, obesity, and even long hours of sitting during the day. When you strain again and again, the veins cannot handle the pressure. The blood starts pooling inside them, and slowly they become swollen. Over time, the walls of the veins become weak, and that is when hemorrhoids start causing symptoms. One of the biggest mistakes people make is ignoring constipation for years. When stool becomes hard and dry, the body has to push harder to pass it, and every time you push too hard, you increase the pressure inside the rectal veins. Many people spend 10 to 20 minutes sitting on the toilet, scrolling on their phone, and they don't realize that this habit alone can worsen hemorrhoids. The longer you sit, the more pressure builds in that area. The body was not designed to sit on the toilet for long periods of time. The natural position for bowel movement is actually a squatting position, which makes it easier for the stool to pass without straining. Another major cause of hemorrhoids that many people don't talk about is low-fiber diet. When your diet does not contain enough fiber, the stool becomes hard, dry, and difficult to pass. Fiber works like a sponge. It absorbs water and makes the stool soft and bulky, which helps it move easily through the intestines. People who eat a lot of processed food, white bread, fried food, and very little vegetables or fruits are much more likely to develop hemorrhoids. The body needs natural fiber from foods like vegetables, fruits, whole grains, seeds, and legumes to keep the bowels moving smoothly. Dehydration is another hidden reason why hemorrhoids keep coming back. If you don't drink enough water, the colon pulls more water out of the stool, making it hard and dry. Then you have to strain again, and the cycle continues. Many people think drinking tea, coffee, or soft drinks is the same as drinking water, but the body still needs plain water to keep the digestive system working properly. Now let's talk about the symptoms, because not everyone experiences hemorrhoids the same way. Some people only notice mild itching, while others feel severe pain. Common symptoms include itching around the anus, pain during bowel movement, bright red blood after passing stool, swelling around the anus, a lump that you can feel, and sometimes mucus discharge. Bleeding can be scary, but in hemorrhoids, the blood is usually bright red and appears on the tissue or in the toilet after passing stool. However, if bleeding happens often, it should never be ignored, because other conditions can also cause bleeding, and it is always better to get checked. Many people try to treat hemorrhoids only with creams and ointments, and these can help for short time because they reduce inflammation and numb the pain, but they do not fix the real cause. If constipation, straining, and poor diet continue, the hemorrhoids will keep coming back again and again. That is why long-term treatment always starts with fixing your daily habits. One of the most powerful things you can do to get rid of hemorrhoids naturally is to improve your bowel movement. Your stool should be soft, easy to pass, and regular. To do this, increase fiber slowly in your diet. Eat more vegetables, fruits, oats, brown rice, lentils, beans, and seeds. Do not increase fiber suddenly because that can cause gas and bloating. Increase it gradually and drink more water at the same time. Water is extremely important. When you drink enough water, the stool stays soft and the intestines move more easily. Most people need several glasses of water spread throughout the day, not all at once. Warm water in the morning can also help stimulate bowel movement. Another helpful habit is not delaying the urge to go to the toilet. When the body signals that it is time, you should go as soon as possible. Holding stool for a long time makes it harder and drier, and that leads to straining later. Your sitting habits also matter more than you think. Sitting for long hours reduces blood circulation in the lower body and increases pressure in the rectal veins. If your work requires sitting, try to stand up, stretch, or walk for a few minutes every hour. Even small movement helps blood flow and reduces pressure. Exercise is another natural treatment for hemorrhoids. Regular walking, light jogging, stretching, or yoga helps improve digestion, prevents constipation, and improves blood circulation. You don't need extreme workouts. Even daily walking can make big difference. For people who already have pain or swelling, warm sitz baths can help a lot. Sitting in warm water for about 10 to 15 minutes relaxes the muscles, improves blood flow, and reduces irritation. This simple method has been used for many years and can give quick relief without medicine. Another thing many people don't realize is that pushing too hard in the gym can also worsen hemorrhoids. Heavy lifting increases pressure inside the abdomen and rectum. If you already have hemorrhoids, you should avoid holding your breath while lifting and avoid excessive straining until the condition improves. Pregnancy is also a very common time when hemorrhoids appear. The growing baby puts pressure on the veins in the pelvis, and hormones make the veins more relaxed, which makes swelling easier. Constipation during pregnancy makes it worse. In most cases, hemorrhoids improve after delivery, but healthy diet, water, and gentle activity can reduce the symptoms. If hemorrhoids become severe, doctors may recommend medical treatments like rubber band ligation, injections, or surgery, but many people can avoid these procedures if they fix the lifestyle factors early. The body has strong ability to heal when the pressure on the veins is reduced. One more important point is stress. Many people notice that their digestion becomes worse when they are stressed. Stress can slow down bowel movement in some people and cause constipation, while in others, it causes diarrhea. Both can irritate the rectal veins. Learning to relax, sleeping enough, and keeping a regular routine helps the digestive system stay balanced. You should also be careful with too much spicy food, alcohol, and very processed food if you already have hemorrhoids, because these can irritate the digestive system and make symptoms worse in some people. Remember, hemorrhoids are very common, and having them does not mean something is seriously wrong with you, but ignoring them for a long time can make the problem worse. The goal is not only to remove pain for a few days, but to change the habits that caused the problem in the first place. When you take care of your digestion, drink enough water, eat enough fiber, move your body, avoid straining, and give your body time to heal, the veins can slowly return to normal size. Inflammation can go down, and the symptoms can disappear. Many people suffer in silence because they feel embarrassed, but this is a normal health issue, and the sooner you understand it, the easier it becomes to fix. Your body is always giving signals, and hemorrhoids are one of those signals telling you that something in your daily routine needs to change. When you listen to the signal instead of ignoring it, healing becomes much easier. Another thing that many people don't realize is that frequent use of laxatives can slowly weaken your natural bowel movement, and over time, this habit can actually increase the risk of hemorrhoids instead of fixing the problem. At first, laxatives may seem like an easy solution. When someone feels constipated, bloated, or uncomfortable, taking a laxative can make the bowel move quickly and the person feels relief. Because of this quick relief, many people start using laxatives again and again whenever their stomach does not feel clear. The problem is that the digestive system is designed to work on its own, and when you keep forcing it to empty using medicines, the body slowly forgets how to move the stool naturally. To understand this better, you need to know how normal bowel movement happens. Inside your intestines, there are muscles that contract and relax in a natural rhythm. These movements are called peristalsis, and they help push the stool forward through the colon until it reaches the rectum. This process depends on nerves, muscles, water balance, fiber, and hormones. When everything is working properly, the stool moves smoothly, without straining. But when someone starts using laxatives too often, this natural rhythm gets disturbed. Some laxatives work by irritating the intestines so that they contract more strongly. Others pull water into the stool to make it softer. While this can help for short-term constipation, using them frequently makes the intestines depend on this artificial stimulation. After some time, the colon becomes lazy and it does not contract as strongly without the laxative. This means the person feels constipated again, even if the diet is not very bad. Then they take another laxative, and the cycle continues. This is how dependency starts. When the colon becomes weaker, stool stays longer inside the intestines. When stool stays too long, more water is absorbed from it, making it dry and hard. Hard stool is one of the biggest reasons people strain during bowel movement. Every time you strain, pressure increases inside the rectum, and this pressure goes directly into the veins around the anus. These veins are delicate, and they are not designed to handle strong pressure again and again. Over time, they stretch, swell, and become inflamed, and this is how hemorrhoids start forming or become worse. Another problem with frequent laxative use is that it can make bowel movement unpredictable. Sometimes the stool becomes too loose, and sometimes it becomes too hard. Both situations can irritate the rectal veins. Diarrhea can cause repeated wiping, irritation, and inflammation around the anus, while hard stool causes straining. When the veins are irritated again and again, they do not get time to heal, and piles keep coming back. Many people also think that herbal or natural laxatives are completely safe and can be used every day, but even natural laxatives can cause problems if they are used too often. Herbs that stimulate the intestines can still make the colon dependent on outside help. The body needs balance, not constant forcing. Occasional use when necessary is usually fine, but daily use without fixing diet and lifestyle can create long-term weakness in the digestive system. Another important point is that laxatives do not fix the real cause of constipation in most people. The most common causes are low fiber intake, not drinking enough water, lack of physical activity, stress, irregular eating habits, and ignoring the urge to go to the toilet. If these causes are not corrected, the problem keeps returning, and the person keeps taking more laxatives. This turns into a habit, and sometimes people feel they cannot go to the toilet at all without taking something. When someone depends on laxatives for a long time, the rectum can also become less sensitive. Normally, when stool reaches the rectum, the body sends a signal that it is time to go to the toilet. But if the bowel is always being forced to empty with laxatives, this natural signal may become weaker. The person may not feel the urge until the stool becomes very hard or very large, and then passing it requires straining. This straining, again, puts pressure on the hemorrhoidal veins. Frequent laxative use can also affect the balance of fluids in the body. Some laxatives pull water into the intestines, and if they are used too often, the body can lose too much fluid. When the body becomes slightly dehydrated, the colon tries to save water by absorbing more from the stool, which makes the stool hard again. This creates the same problem the person was trying to fix. Hard stool leads to straining, and straining leads to swollen veins. Another hidden problem is that some people take laxatives even when they are not truly constipated. They may feel that they need to empty their bowels every day, or even more than once a day, and if that does not happen, they think something is wrong. But normal bowel movement can be different for different people. For some people, once a day is normal. For others, once every 2 days can also be normal if the stool is soft and easy to pass. When someone forces bowel movement with laxatives just to feel empty, they may be putting unnecessary stress on the intestines and rectal veins. People who sit for a long time on the toilet after taking laxatives may also increase the risk of hemorrhoids. When the intestines are stimulated strongly, the person may feel the urge to push, even when the stool is not ready to come out easily. Sitting and pushing for a long time increases pressure in the lower rectum. The veins fill with blood and become swollen, and if this happens again and again, piles can develop. Another thing to understand is that the walls of the veins around the anus are not very thick. They are designed to allow blood to flow, not to hold high pressure. When someone strains, the pressure inside the abdomen increases, and this pressure goes down into the pelvic veins. If this happens once in a while, the body can handle it. But when it happens every day, the veins start losing their elasticity. They become stretched and enlarged, and once they are enlarged, it is easier for them to swell again in the future. Frequent laxative use can also disturb the healthy bacteria inside the intestines. The gut contains billions of bacteria that help digestion, help stool move smoothly, and keep the lining of the intestines healthy. When bowel movement is forced too often, this balance can change. Poor gut balance can lead to gas, bloating, irregular stool, and irritation. When digestion is not smooth, constipation and diarrhea can both happen, and both can make hemorrhoids worse. Some people notice that after using laxatives for a long time, they feel that their stomach never feels completely normal. Sometimes they feel empty, but weak. Sometimes they feel bloated, even after going to the toilet. This happens because the natural rhythm of the intestines has been disturbed. The body works best when it follows a regular pattern of eating, digesting, and eliminating waste. When this pattern is controlled by medicines instead of natural signals, the system becomes less stable. The safer way to improve bowel movement is to support the body instead of forcing it. Fiber is one of the most important things for this. Fiber holds water, makes stool soft, and helps it move without irritation. Drinking enough water keeps the stool from becoming dry. Physical movement helps the intestines contract naturally. Eating at regular times helps the digestive system stay on schedule. Going to the toilet when the urge comes helps the rectum stay sensitive and responsive. For people who already have hemorrhoids, this is even more important. The goal is to make bowel movement smooth and easy so that the veins are not under pressure. When stool passes without straining, the veins get time to heal. When there is less pressure, swelling can go down, pain can reduce, and bleeding can stop. But if someone keeps using laxatives and still strains, the healing becomes slow, and the piles may keep returning. Another mistake some people make is using strong laxatives after surgery or after severe hemorrhoids, thinking that very loose stool will protect the area. But very loose stool can also irritate the skin around the anus, causing burning and inflammation. The best stool is soft but formed, not hard and not watery. This balance is what the body naturally tries to maintain when digestion is healthy. It is also important to remember that the body can recover its natural bowel movement, but it may take time. If someone has used laxatives for months or years, the intestines may need some time to become strong again. During this time, gentle changes in diet, more fiber, more water, and regular activity can slowly bring the rhythm back. Patience is important because quick fixes often create long-term problems. Many people feel embarrassed to talk about constipation or laxative use, so they keep managing it on their own without understanding the effects. But the digestive system is very sensitive to daily habits. Small things repeated every day can have a big effect over time. Using laxatives occasionally when really needed is usually not harmful, but depending on them regularly without fixing the cause can weaken the natural function of the intestines and increase the pressure that leads to hemorrhoids. Another factor that often gets overlooked when talking about hemorrhoids is the role of chronic diarrhea and digestive disorders like irritable bowel syndrome or IBS in causing repeated inflammation of the hemorrhoidal veins. Many people assume that only constipation can cause hemorrhoids, but in reality, frequent diarrhea and irregular bowel patterns can be just as damaging, if not more so, to the delicate veins in the rectum and anus. When stool passes too quickly through the intestines, the body loses the natural rhythm of digestion. The rectal veins are designed to handle regular, formed stool, not frequent watery bowel movements. When diarrhea happens often, the lining of the rectum and anus is exposed to repeated friction and irritation, and this constant stress can make the veins swell, weaken, and become inflamed. IBS, in particular, is a condition where the bowel does not function normally. Some people with IBS experience mostly diarrhea, some mostly constipation, and others alternate between the two. In all these scenarios, the rectal veins are under stress. With diarrhea-predominant IBS, the stool is often loose and watery, which means the anal canal is repeatedly exposed to moisture, acidity, and friction. This exposure inflames the delicate veins and surrounding tissues. Over time, these veins lose elasticity and become more prone to swelling and bleeding. Even mild diarrhea, if it happens multiple times a day, can lead to repeated microtrauma in the area. Unlike constipation, where the damage is caused by straining, diarrhea causes damage through constant irritation and exposure to the components of stool that can irritate skin and veins. Many people with chronic digestive disorders do not realize the connection between their bowel habits and hemorrhoids. They may focus on treating diarrhea alone with medications or dietary restrictions, but the repeated inflammation in the rectum and anus continues silently. Every time the bowel moves too quickly, there is an opportunity for the hemorrhoidal veins to swell. Over time, the veins may protrude, become painful, or bleed with even mild bowel movements. This is why people with chronic diarrhea often notice that hemorrhoids flare up repeatedly, even when they are careful about diet or other lifestyle factors. Another issue is that chronic diarrhea can lead to skin irritation and itching around the anus. The combination of moisture and repeated wiping damages the protective skin barrier. This makes the area more sensitive and more likely to develop inflammation. When inflammation occurs, blood flow to the veins increases, which causes them to swell further. The more someone scratches or wipes, the more irritated the area becomes, creating a vicious cycle of inflammation and discomfort. For someone dealing with IBS, this cycle can be persistent and frustrating because the digestive disorder itself is chronic, so flare-ups and hemorrhoids happen repeatedly. It is also important to understand that diarrhea affects the pelvic floor muscles indirectly. When bowel movements are frequent and urgent, people may rush to the toilet, sometimes straining or clenching to control the urge. This repeated tension in the pelvic floor muscles can increase pressure in the rectal veins. Even though the stool is loose, the act of trying to control it adds stress to the same veins that are vulnerable to swelling. Over time, this repeated pressure contributes to the formation and persistence of hemorrhoids. Diet and hydration play a critical role here. Chronic diarrhea can lead to dehydration, and dehydration thickens the remaining stool in the intestines. When diarrhea alternates with periods of normal or slightly constipated stool, the rectal veins experience a mix of stress, loose stool causing friction, and dry stool causing straining. This combination is particularly harmful because the veins do not get a chance to recover between episodes. Each flare-up keeps the veins inflamed, making them weaker and more prone to swelling. Another factor with IBS and chronic diarrhea is gut inflammation. In many cases, the intestines themselves are inflamed, which can make bowel movements irregular and uncomfortable. This inflammation can spread to the lining of the rectum, further irritating the veins. Chronic low-level inflammation in the gut not only affects digestion, but also compromises the ability of the veins to maintain their normal structure and function. The more inflamed the area becomes, the more likely hemorrhoids are to form or worsen. Stress also plays a major role in this connection. IBS and other digestive disorders are often aggravated by stress, and stress itself affects gut motility. When stress triggers more frequent diarrhea, the rectal veins are exposed to repeated inflammation, and the cycle continues. Stress may also make people tense their muscles more, sit longer on the toilet, or wipe excessively, all of which increase pressure and irritation in the anal area. People often rely on medications to control diarrhea, such as antidiarrheal drugs, probiotics, or diet modifications. But while these can reduce the frequency of bowel movements, they do not immediately repair the damage that has already been done to the hemorrhoidal veins. Recovery takes time, and during this period, maintaining gentle bowel habits, avoiding excessive wiping, and keeping the area clean and dry are crucial. Sitz baths in warm water, gentle cleansing, and applying natural protective ointments can help soothe the veins and surrounding tissue while the digestive system stabilizes. Some people with chronic diarrhea or IBS may also use fiber supplements to bulk up their stool. This can be helpful if done carefully because it slows down transit and makes stool more formed, reducing friction on the veins. However, too much fiber too quickly can worsen diarrhea initially, so it needs to be introduced gradually. Soluble fiber, like oats, psyllium husk, and certain fruits, is usually better tolerated than insoluble fiber in diarrhea-predominant IBS. The goal is to allow the rectal veins to experience smoother bowel movements that do not irritate or inflame them. Another complication is that chronic diarrhea can lead to minor bleeding from the hemorrhoids, even if they are small. Many people notice bright red blood on tissue or in the toilet. While this bleeding is usually not dangerous in itself, it indicates that the veins are inflamed and under repeated stress. If the underlying digestive disorder is not addressed, the inflammation continues, and the hemorrhoids may gradually enlarge, become painful, or develop clots.